Breastfeeding. It is going to be a little bit overwhelming after you have your baby, and there's a lot to know about breastfeeding, but one of the things you really need to know about breastfeeding are the signs that it is not working. And today I'm going to go over those signs with you and show you how to get help if you think breastfeeding is not working. This video is so important because this is really the most important part of breastfeeding, is making sure that you're actually feeding the baby. Now, a lot of people online and some nurses at the hospital just act like breastfeeding always works. And in fact, that's how I felt. I had done labor and delivery, I had done postpartum during nursing school, and I got home and I just thought breastfeeding always works. It's never a problem. I don't know why I thought that as a nurse, but I just went home thinking it would be just fine, only to find that breastfeeding was not working and we had some of these big signs and I needed to get help. And so I did end up getting help, but I want you to be smarter and do better at parenting than I did. So let's jump in. Like I said, there's a lot of misinformation about that everyone can breastfeed online, and that is not the case, unfortunately. So make sure that you're learning about breastfeeding from an expert. I wouldn't say that I'm an expert on breastfeeding. I definitely have helped lots of people breastfeed, but I am not a lactation consultant. In the online prenatal class for couples, I actually asked my friend Katie from the Breastfeeding Mama to do the breastfeeding section because she is an expert, and I am mostly an expert on when it's going wrong or what we can do to get you help. Okay, let's go over some of those signs that it is or is not working. The first one is wet diapers, and this is actually what I noticed for myself. First off, I had a super crying baby, but that can't always be a sign because some babies are just a little bit fussier than other babies, but I was ultimately starving my kids, so wet diapers is a good sign. Now, when you have your baby is going to start with one diaper per day of age, one wet diaper per day of age. Now, poopy diapers a lot of times can have wetness with them, but you're looking for the wet things. And on newborn diapers especially, usually there's a line that will turn a different color when the baby pees so that you can tell if they're having a wet diaper. So like I said, one diaper per day of age until they're getting 6 to 8 wet diapers a day. So within the week, you should be having about 6 to 8 wet diapers every day. And that shows that they are getting milk because the milk is being processed and they're peeing out the extra. And I think for a lot of people, they're super concerned that baby isn't getting enough. And those wet diapers are definitely evidence that baby is getting enough. And I'm someone who can testify that those wet diapers start to stop if you are starving your baby. Yes. The pregnancy nurse. Okay, the second thing that shows at least you have milk is engorgement. As someone who does not get milk, I never get engorgement. So if you're feeling your breasts get tight and mildly annoying, that is at least a sign that your breasts are filling with milk. Now, I have heard that some people can get engorgement without producing milk. I'm not exactly sure how that happens, but I will say that I didn't really get engorgement and I never felt that way and I didn't get any milk. So if you're having engorgement, it's a good sign, although an annoying sign. And if you're starting to be like, okay, this isn't sounding so great, come grab my birth plan series where you can get prepared for what you want your postpartum experience to look like. I'm going to put the link down below. It's called Birth Plans Made Easy. Okay, another sign that breastfeeding is working is when you pull them off, you see that they have some milk in their mouth. As someone who doesn't get milk, my babies do not have milk in their mouth. So even though you're like, is that milk or is that just kind of how their tongue looks? Try and take a peek at their tongue when they're not feeding so you'll know what it looks differently when milk is on it. Now, colostrum, which is usually what you'll have in the first 2 to 3 days, is a little bit more transparent, so you might not notice it as much, but milk in their mouth is a great sign that something is transferring. Okay, another great sign that breastfeeding is working is weight gain. Now, there are a lot of really cool scales that double as like a changing pad. If you're interested, you can grab some of those, although sometimes I think it just increases our stress because they're not going to gain weight continually. It'll be an up and down thing, and when you have the downs, I don't want you freaking out because that doesn't make you a great parent. But if you're interested on if your baby is gaining weight overall, those can be really helpful. I'll try and put a link to one down below. Also, if you're worried about it, a lot of pediatricians' offices will do a weight check for you, totally free. You can just bring your baby in and have them weighed. And if you see a lactation consultant, a lot of times what they'll have you do is weigh the baby with a clean diaper on, feed the baby, and then weigh the baby again to see if they're gaining weight during that breastfeeding session. As someone who does not get milk, when I do those breastfeeding sessions, my baby ultimately loses weight because they're putting all this effort trying to suck and not actually getting anything. So I can tell you that that actually works. Another great sign that breastfeeding is working is hearing swallowing. Now, they are not going to be most likely gulping like when we chug down a beer or something, but you are going to hear gentle swallowing sounds. And a lot of times on a baby, it sounds just like a k sound, like the letter C, like if you whispered the letter C, k. It's just that kind of a sound. It's pretty quiet. Another thing you can notice is if their Adam's apple bobs or if their cheeks kind of pucker funny, that might be a sign of swallowing too. Okay, so what do you do if these signs are not pointing to good things? How do you get help? First off, the worst part of breastfeeding is the fact that the more you stress about it, the worse it gets. And Hillary definitely got into a spiral of freaking out about breastfeeding and definitely wasn't helping my milk supply if I was ever going to get any. You want to meet with a lactation consultant. And if you are seeing these signs, I would recommend meeting with a lactation consultant in person. There's a lot of online ones that can be helpful, but if you are having symptoms that you really are not feeding the baby well, you need to meet one in person. Usually hospitals have a lactation consultant associated with them. Ask around with friends. If you haven't gone in to have your baby yet, I think it is an awesome idea to get a lactation consultant appointment set up before you leave the hospital. We have you see a pediatrician. I will say that not all pediatricians are great at breastfeeding. Some are pretty good at it, but many are not great at breastfeeding. So I think having a follow-up appointment with a lactation consultant by 1 or 2 days after you get home would be a really smart thing to do. And at the very least, get a contact from your hospital about who you could see if you end up having a problem. And if you're interested in getting help with a lactation consultant, because a lot of times this is covered by insurance anymore, ask around while you're pregnant and see who your friends liked. Because I am here to tell you that there is a wide spectrum of lactation consultants. Some are breastfeeding Nazis, that there is only one way to do things, and some are very, what works for you kind of a thing. And you know me, I'm much more on the what works for you end of the scenario. So pick one that you think works for you. Now, if you're like, Hillary, why on earth would breastfeeding not work? Let me give you a few of the reasons. First off, implants a lot of times will decrease your milk supply. A lot of times they won't, but it really just depends. And oftentimes we don't know until you start trying to breastfeed. Hormonal imbalances can be an issue. Tubular breasts, which is I think what I ultimately had, where your boobs are more tubes than balls. So weird. Can be an issue. Stress. In fact, the studies that I read when I had my baby is that there are more issues with milk supply during wartime than there is during peacetime, which I thought was really interesting. And maybe we all feel like we're at wartime right now. I don't know. Lack of stimulation. Sometimes baby may need something helped orally. Sometimes there's a tongue tie or a lip tie, or they just need some oral help. And they're actually baby occupational therapists that will help your baby learn how to suck better. There are lots of different reasons, and that's why a great lactation consultant will be worth it. As a note, there's a lot of different lactation words out there anymore, and I recommend an IBCLC, a lactation consultant, not a lactation counselor, not a lactation educator. I recommend a lactation consultant because they can really do all the troubleshooting with you a little bit more. The other two are more for just education. And here's where we get to the point where I share, as I've shared before, breastfeeding didn't work for me. And I would see things come up on the news that kids who were breastfed had higher ACT scores, and I would burst into tears. And I was just so frustrated with myself that the milk wouldn't come in. And on every subsequent baby, I've had 3, I thought this is the one, suddenly my body's going to work and I'm going to be able to produce milk. And every time I would end up getting disappointed and I would cry and I would cry and I would feel like such a failure. And I'm here to tell you that my oldest, who I almost starved to death, is 25 now. He's graduated from college, has a great job, and he's thriving in life, even though he was formula fed. And I hear a lot of times online about how bad people feel when breastfeeding doesn't work for them. And I'm just here to say that you've got to make it work for you. And not getting enough milk isn't the only reason to stop breastfeeding. Some people get really crazy feelings when they have a letdown and they feel really anxious. And I can see that as a reason why I would not want to breastfeed. Some people just get stressed out at the whole thing. And you have to realize that it is the whole picture. Is your stress really worth the breastfeeding benefits? Now, of course, I am here to say that I do think breast is best. I think there's a lot of advantages to breastfeeding, but I think the biggest thing you need to watch for is that you and baby are both thriving, because if baby has a mom that's not thriving, baby is unlikely to thrive as well. I think breastfeeding is really misunderstood, which is why I have a bonus video in the online prenatal class for couples all about breastfeeding, just the beginning things. I don't think you need an in-depth breastfeeding course before you go in to have your baby, but knowing tips like this, which are also included in the online prenatal class for couples, that can help you know if it's working or not working and how to take steps moving forward, is going to be so helpful. And finally, I always say that not breastfeeding my child wasn't even close to the worst mistake that I made as a parent. You know, there were a lot of choices that I made through all of my parenting journey, and you just got to make the one that works for you at the time. Now, almost starving my baby is one of the mistakes that I made, but there are other mistakes that you can make during pregnancy. I'm going to put the video right here. Thanks for joining us at The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth and bringing baby home.